There's no conventional cure for this thing. So they can test till the cows come home. They can't do anything about it.
Fear of the unknown, a pandemic with so many questions and so few answers. From Wall Street to Main Street, concern over COVID-19 has gripped much of America.
Joining us now to answer some of those questions and hopefully ease some concern, we have Dr. Nancy Gin. She's a medical director at Kaiser Permanente with a specialty in internal medicine.
Also with us tonight, Laura Rhodes-Levin. She's the founder of the Missing Peace Center for Anxiety. Welcome to you both. Dr. Gin, to you first.
Thank you.
A lot of uncertainty about symptoms and what you should do. Let's start with the symptoms. What are they, and how do we determine whether it's coronavirus versus a common cold?
Well, I actually think for most people, it will be indistinguishable.
Okay.
The vast majority of individuals will have cold-like symptoms. They'll have a little fever, maybe some cough, a runny nose. But for most of these individuals, they will deal with it and they will get on with their lives and do just fine. It's really the elderly and people who have weakened immune systems, underlying heart disease or lung disease, diabetes, can also predispose people to having a harder time fighting this.
So for a lot of people, it's mild to moderate symptoms is what they'll feel and experience.
Absolutely. For most people,
okay,
it's mild to moderate.
Okay.
And Laura, you know, you deal with anxiety, and a lot of anxiety comes in the last couple of weeks, and it's just been growing literally by the hour. I mean, everything's changing. It seems like a domino effect, and people are stockpiling and standing in line at Costco at 7 a.m. when it opens at 10 a.m. I mean, what do you say to the people, you know, who are having this massive anxiety, who have travel plans in the summer? Do they go? Do they cancel?
Yeah, those are all such good questions. And what I'm trying to tell my clients is, be careful, but don't be fearful. Be full of care, but not full of fear. And I think that's what's so confusing about it, is that most people will be okay. And the cure for anxiety is to stay in the moment. But when they're telling people you won't know if the moment's here for 2 weeks, it makes everybody start stockpiling. And my own mother was there at 7 o'clock this morning to buy paper towels. She's 86, and toilet paper. And she said, and they didn't have any. So I got napkins instead. And I was like, good for you. Because the markets are going to restock. It's this urgent rush that we have to think of all this time out. You're just taking care of yourself right now in the moment. You're probably okay.
But the people are seeing also the stock markets, you know, the stock market plunge, you know, on a daily basis. That's also causing a lot of anxiety.
It is. And for a lot of us, a lot of people don't have stocks in the stock market. So for the people who are being affected, this has always been a long-term gain. This is all, we've seen the stock market crash. Nobody wants to open up their portfolio and see, oh my God, it's down. But someone was saying earlier, I'm not a stockbroker, but maybe it's time to buy. Maybe this is your chance to get in on stocks that you wouldn't have been able to get in on before. It's going to change. It will come and go in a wave. And it's hard when you're in that first crash of the wave to think this set is going to calm down, but it will.
Perspective is critical in all of this. Knowledge, the antidote to fear. And dare I say, in seeking knowledge, social media in particular can be more harmful than helpful.
Yeah, absolutely. And it works interestingly opposite this time, because usually people look at social media and they think, why don't I have the happy husband and the dog and the kids, and they have no idea what's going on behind the scenes. And now they're seeing fear, and they connect with so quickly. It's not like, oh, that's them, that's not me. It has the opposite effect.
Dr. Gin, you know, a lot of people are worried about the amount of testing kits that are out there, that are available, the fact that there aren't chemicals that could actually, you know, make these tests readable. I mean, a lot of people are worried about that too, that the reason why we have such low numbers is because we don't have enough tests to confirm who's sick.
Well, in some ways, they're actually correct. Because the vast majority of people can go through their day and not even realize they have the infection because they don't have any symptoms or have such mild symptoms as we talked about a moment ago. they don't really need to be tested. And so because we don't have access currently to as many tests as we would like, we are not counting those people.
Where do people go if they are, I mean, do they go to the hospital? Do they wear the masks? I mean, there's also a shortage of that too.
Right. And actually, neither of those.
Okay.
Because for people who have really just very mild symptoms, you feel like you've got a cold, you're just feeling kind of punk, stay home.
Okay.
We really want people to stay home. Stay home so that you're not exposing other people to you. And certainly contact your healthcare team if you're feeling that your fever is not going away with usual medications that you use, like aspirin. Contact them if you are having, significant shortness of breath. But if you're just feeling a little bit coughy, a little achy, just stay home.
What are we doing to protect the elderly? Advice for extended family that may live together. And again, worth reiterating, the vulnerable sector of society.
Right. And so, I think all of these elements that we've been talking about, the cancellation of all these events, are to try and provide what we're now terming social distancing, to prevent large numbers of people from getting together. And that's helpful. So if I had a family member living with me who has vulnerability, I would not allow them to go to large gatherings. I would absolutely let them go walk the dog outside. Absolutely, they could go to the market and do their shopping. But in terms of going to someplace where there's large numbers of people, going on a cruise ship, would not recommend things like that at this time.
Well, these major sporting events, that are falling like dominoes, everything canceled. We have, just 4 or 5 stories a night just on what's, being canceled. This is also causing a lot of anxiety, Laura.
It is, because there's something very tribal about sports, and it's a way we feel a bond with everybody, and it's a big pastime. But when he was saying it's the day the music died, but it was like for sports, I was thinking, hopefully it's just the day that sports took a nap and got into bed for a little bit. Yeah. And this is a chance to connect with people in the room. We've become such a society of staring at one screen or another. If you really need a game, ESPN's got great, history games. Go back and watch your old game. But play some games with your family. Play right there with the people that are right there in the room with you. And those games are going to come back. But it is hard. It's a release for people, but it's a neat way to find new interests that you never would have possibly thought of before.
Laura, there's a lot of anxiety out there, as we have come to see, in particular those who are predisposed to anxiety. What are you telling them tonight? So
again, it's about being careful and not fearful, being in the moment of it. Let's say in the worst case scenario, let's say someone really contracts it and this really will be it. Don't spend your last few days worrying about it. Enjoy what you're doing. Enjoy what you're doing right now. Staying in the moment is really what I like to tell people. Stay in the moment, because right now you're probably okay. And if you're not, you're going to get help and do the best you can to be okay, and keep your loved ones around.
Mindfulness.
Yeah, mindfulness. Mindfulness when you're washing your hands is what everybody's saying. Social distancing. So many, just a list of things of how life has changed. Our daily life has changed just in the last couple of weeks.
Right.
Yeah.
All right. Dr. Gin, Laura Rhodes-Levin, thank you both so much for taking the time.
Always great.
Thank you so much.